All right, let's get started. So, thank you everybody for joining us for tonight's webinar all about burnout. So, tonight we have Dr. Erik Nelson from Nirvana Health Clinic here in Calgary. So, welcome and thank you for joining us.
Thanks for having me, Lan.
Yeah. So burnout. Let's maybe talk a little bit about what that is exactly and maybe the difference between burnout and stress.
Oh, yeah. Burnout, to be honest, this is the hardest part of the entire talk, is how to define burnout, because there are a lot of different definitions depending on where you look. But my favorite definition of burnout syndrome or clinical burnout syndrome is simply a state of emotional exhaustion, physical fatigue, and cognitive weariness caused by long-term uncontrolled and unresolved stressors. So you have the word stressors in there, but it's not simply the same as just experiencing stress. Because stress, as you know, is a challenge to the system and you can respond in a lot of different ways. Burnout syndrome is essentially when your capacity to handle whatever those stressors are has been beaten down to a point where you're starting to show a specific set of symptoms. And the reason there's a lot of different definitions for burnout is because burnout, as it's been studied, is really specific to one or two niches. So the original burnout definition, I think, came from Maslow, which is back in like the 1980s. And 100% of his work was on burnout in the workplace. So all of the language around it, the syndrome was really coined in terms of of employees that were emotionally exhausted and they were withdrawing from their work, and not only withdrawing, but their performance was suffering, and they were needing to characterize this because it was happening a lot more commonly than was previously thought. So they created a syndrome. Now that it created a lot of different fights within how you define it, because there's so much overlap with depression and anxiety and even ADHD, and just general states of fatigue. So at the end of the day, you end up having more people with opinions than with consensus statements.
Yeah, and I'm sure some people experience different components of those emotional, physical, mental symptoms as well.
Yeah. And it's considered a syndrome. So if you're familiar with the medical field, syndrome just is basically a diagnosis of exclusion. It is generally not something that you can get a one single blood test for, or even a panel of blood tests, and then get a diagnosis. You actually have to rule out all the autoimmune conditions, all the adrenal conditions. You have to rule out many of the mental emotional conditions, before you can actually be given the diagnosis of clinical burnout syndrome.
Oh,
So
okay.
there's some labs that can help you along the way, but majority of the labs that you're doing actually are ruling out other things that would be contributing to the exact same symptomatology as you'd experience with clinical burnout.
Right. Would it be helpful, like, is there some sort of checklist of like, these are specific emotional, physical, mental
Yeah,
symptoms, that kind of, and
yeah,
of course it's gradual, like, this doesn't happen overnight. So yeah, we can
yeah.
talk a little bit more about recognizing those, but yeah, I guess is there, some checklist items?
There's a handful. So again, it depends on where you look. The one
Yeah.
we use in the clinic is the burnout assessment tool. It's called the BAT. Admittedly, it has some flaws. It's really not granular enough and the nitty gritty on the mental emotional exhaustion piece, in my opinion. But it does encompass a number of different categories that you can look into. The classical Maslow burnout inventory has basically three categories. It's depersonalization, which is really common in males. In fact, with males, this is the part of burnout that's most obvious, and it's essentially where you're not viewing others as fully human. I know it sounds kind of crazy, but it's you're depersonalizing other people. So you would not consider their, like, your actions impacting their feelings. You don't really care how it makes them feel. You don't necessarily have that empathy that you might even have for somebody that you love. So for
Mhm.
example, parental burnout is very common, and one of those common symptoms in depersonalization category is that you can discipline and you don't feel any reproach, like you don't feel any, you don't feel bad at all,
Mhm.
yelling at your kids or getting really angry or being really irritable, or treating your spouse in a certain way because you feel like you just don't, you're at your limit and you have no cognitive and mental and emotional reserve to help yourself emotionally regulate. So you take it out on other people, and that those symptoms will show up, and people will kind of recognize that. Oh yeah, that's happening to me. I'm more
Mhm.
angry than normal. I'm more actually my, for lack of a better phrase, my give a shit factor is really low.
Mhm.
Like I just
Mhm.
don't care how this affects other people. And then I also, if it's in the work scenario, I just don't care if I get good work done. I don't really
Mhm.
care if this even, if we even hit this deadline anymore. I've just kind of given up, or I've hit my threshold. And that's, those are the classic signs of, this is not just mild form of burnout. This is turning into clinical burnout syndrome, which you should go and get, you should seek some professional help for,
Mhm.
get some workup done, because it's affecting your quality of life. That's another part of the definition. I'm kind of circling back to this, but it's trying to set the
Mhm.
stage for the rest of the conversation, which is most people wax and wane through all of these symptoms: emotional fatigue, right? Irritability, anger, short temper, depersonalization, emotional exhaustion, feeling like you're not succeeding at work. But you wax and wane, and you typically, it does not interfere with your quality of life that much, and it does not interfere with your quality of work that much, and you don't need to seek professional help for it. As soon as you cross that threshold where the quality of life piece is really impacted by X, Y, or Z symptoms, then it becomes, this is significant likelihood that you need to be worked up for clinical burnout syndrome. Yeah,
Mhm.
yeah.
Is there Oh, sorry, go ahead. Mhm.
To go back to the categories, there's the depersonalization. There's a lot of things in there that people would recognize. There's the exhaustion, and the exhaustion piece is self-explanatory. There's emotional exhaustion, and then there's physical exhaustion. And honestly, people come in to me more often because the physical exhaustion is so pronounced that it impacts everything else. So the physical exhaustion, meaning like you got 8 hours of sleep and you woke up feeling like you didn't get any sleep, and
Mhm.
that persists through the day. And you feel like you could, regardless of how much you work, how much you sleep, how much time you're spending on quote unquote self care, how many massages you get, you don't feel like the batteries charge up anymore. So that's a really deep set exhaustion, physical, and eventually mental, emotional, and spiritual as well. And then the
Mhm.
decreased sense of accomplishment is technically like the third arm within the Maslow's burnout inventory.
Okay.
So decreased sense of accomplishment is literally like, if you're a parent, you think you're not doing a very good job. Like you're just getting by keeping the kids alive. You feel like all the other parents you see are doing a better job than you. If you're at work, you feel like your colleagues are progressing faster in their careers, they're getting better results, they're making more sales, they're just outperforming you, X, Y, or Z, like you name it. You can see this show up in your own self talk more than you will see in other people's reflection of how you're doing.
Right.
Yeah.
Yeah. Yeah, I was gonna ask about more of the physical component. You'd mentioned just that complete exhaustion, but are like muscle tightness
Oh
or,
yeah.
that constant just like
Yeah.
stiffness, ready to fight or flight kind of thing.
Yeah. So that goes down to the cause. So what causes burnout? Um, we all have a stress response system, right? And the two main branches of the stress response syndrome system is the HPA axis, which is what everyone thinks about and knows about when they hear the word cortisol. They hear stress, they think of stress.
Mhm.
That axis, which is your brain and your amygdala responding to a stressful stimulus, whatever it is, sending out the troops, which includes cortisol from your adrenal glands. And cortisol will have a whole bunch of effects, right? It puts sugar into your bloodstream. It gets a little bit of adrenaline going. It gets your core body temperature to come up. It'll raise your shoulders, increase the muscle tension, get you ready to either fight, flight, or freeze. And then the second part of this is almost the they do the exact same thing at different time points. So the second branch is the sympathetic nervous system. So you'll get a huge increase in what's called sympathetic drive, and that's where a lot of the muscle tone comes in, the anxiety states, the racing heart, the palpitations, Um, Essentially, in a case of burnout, you will be fluxing between these two systems. You will be vacillating between these two systems, and you will
Okay.
notice both of them way too often. So you're going to notice you're always stressed out. You're going to notice you're holding a lot of tension. You're going to notice your heartbeat all the time. You're going to notice your palpitations. Or you're going to notice that you're feeling anxious. Like the anxiety is not just a baseline hum; it's starting to show face, right? So from a physical standpoint, it's often not just the fatigue part, but it's the wired and tired part. So you're having a
Mm.
ton of the wiry symptoms because when you're in full-fledged burnout, this is one of the things we can find out within lab work we do, is you will end up relying more and more on that really quick sympathetic nervous system, the sympathetic drive to get you through your day, because you will still be able to get stuff done, but you're doing it in such a way that you're actually going to deplete yourself more afterwards, if that makes sense. It's like a performer knowing they have to
Mm.
perform and they have to be
Yeah.
on, they have to do it, and they get really ramped up, and then they do the show. They absolutely do a great job. Inside, they might be beating themselves up. As soon as they go home, they're completely wiped, right? They're so wiped that they end up having to take, like, they can't talk to people. They're not going out for drinks after. They're not celebrating the performance. They are they are needing to go into the hibernation mode in order to just survive the next day, right? So those are repercussions of some of the physical, um, basically the physical systems that are at play within the burnout picture.
Hmm. So in terms of testing, you mentioned cortisol. Um, would doing something like that, among others, as you mentioned as well, kind of ruling other things out. But yeah, what are some specific tests then would you run?
Yeah, we do a lot. So you end up doing quite a bit to rule stuff out, like I said. So I won't touch on that because it really depends on what are the main symptoms somebody's coming in with and
Hmm.
what brought them to the office. Was it a workplace stress? Did they just have a child and they're not sleeping? Right? Is it unresolved anxiety that they haven't dealt with and it's flaring up, right? Um, so those aside, the most common test that we're going to run is called a Dutch test with a cortisol awakening response test added on. Um, Dutch is a dried urinary catch test. It basically is a hormonal test, 24-hour hormone test. It's looking at a number of different hormones that are going to be not only produced but also metabolized and cleared through the urine. So it
Mm.
can tell us a lot about not just what's in your blood at this one time when we take a blood draw, but actually how much have you produced throughout the whole day and how much have you cleared, and then what are you doing with those hormones. So that's true for cortisol. You're not just looking at cortisol because that's the active form of the hormone, the corticosteroid, but you actually also look at cortisone, and that's an inactive form of the corticosteroid, right? So both of those things and the ratio or balance between those two things actually it fills in the picture. It tells us some more information.
Mhm.
I really like doing the cortisol awakening response if I'm at all worried about burnout, or if it goes by other names like low energy availability or overtraining syndrome, depending on the patient.
Mm. Right.
Um, I always do a cortisol awakening response because it's a measure of how adaptable and how responsive your nervous system is today or this morning.
Mm.
So that plus heart rate variability gives us both branches of the stress response. The heart rate variability is looking at the sympathetic and parasympathetic nervous system. The cortisol awakening response is telling us about the HPA axis and how they're talking. So has any of the other guests talked about the cortisol awakening response on this? I don't know if that's the first time it's been brought up.
Yeah, I believe when we're talking about like women's hormones and stuff, I think that came up a few
Yeah,
times. Yeah.
yeah. Cortisol awakening response is going to be superior than just checking your cortisol in the morning, which is what most family doctors will do. So most family doctors will do a blood test,
Yeah.
AM cortisol test. And that's essentially just it's assessing how well the adrenals are doing. So are the adrenals able to produce hormones? Yes or no. That's all it's checking for. So it's really it's screening out. Again, it's not a bad thing to do this, but you screen out Cushing's disease, Cushing's syndrome, and
Mm.
Addison's disease,
Yeah.
right? But it leaves a lot, a lot on the table that you haven't worked up. So this cortisol awakening response test is a saliva test where you wake up first thing in the morning. Within 5 minutes of waking up, you take your first sample. So you swab it, you throw it in a tube. At 30 minutes after waking up, you take a second swab, 60 minutes, 120 minutes. And that first 2 hours of the day, technically we look at the rise and fall of that hormone because it technically should respond to you waking up. It's called the cortisol awakening response. So your cortisol might start to rise a little bit before you wake up. It should. It's actually one of those things that helps you get up and helps you wake up. But it should just slightly rise. And then as soon as you open your eyes and you put your feet down and you have gravity on you, especially if you flick a light on, you get some light exposure, you should get a surge of cortisol. A healthy cortisol awakening response is like 50 to 85 to 100% increase. So you basically can double your cortisol in your bloodstream in the first 30 minutes, and then it should come down pretty quickly as well. To the point where at 2 hours, it's actually quite low and it should stay low throughout the rest of the day. Right. So
Right.
cortisol awakening response is really helpful. And then the purpose of doing the Dutch test as well is you'll see the total amount of cortisol produced, the total amount of cortisone produced, and then the ratio between the two. Right. So if you're having spikes throughout the day, you might not catch those individual spikes, but you'll catch the overall output.
Mm-hmm.
Yeah.
So what is the solution? If someone if someone comes in, the $1 million question, yeah, if they get a bunch of tests done and they find, those abnormalities, what are kind of the next steps into kind of treating this? I'm sure there's plenty that we can go through.
Yeah. Yeah. I'm going to go into honestly, the rule out piece of the pie first,
Okay.
because often treating, it's very unlikely that somebody comes in and the only thing they have going on is burnout, is just clinical
Right.
burnout.
Mm-hmm.
They almost always have other things that contributed to the stress on their body,
Mm.
right? And so, very commonly in my practice, that's chronic pain. But I also see a lot of patients with insomnia,
Mm-hmm.
hypogonadism or low T, right? As well as ADHD, anxiety, depression, the classic bunch right there, right? So there are even things like post-concussion syndrome can play a role into it, mitochondrial disorders, chronic infections. There's so many things that would lead to additional stress on the system and an inability to respond to that stress, right? So if I just assumed it was burnout and I went into, okay, let's try to mitigate and remove whatever stressors we can, whatever obligations that you have said yes to. This is
Mm-hmm.
the answer to your question. This is the first thing you do is you go into all of those obligations you said yes to that you don't actually need to do. You just thought you needed to do it. You thought it was a good idea or looked good on you. A very
Yeah.
Canadian thing for you to do, but it's actually depleting you and you're getting absolutely nothing out of it.
Mm-hmm.
Those are classic places where you would start. But if I just started there and I did not treat the underlying anemia you had, or the chronic infection you have going on, or the fact that you have
Mm.
ADHD that's unmanaged, because ADHD and burnout just go hand in hand. ADHD, insomnia, anxiety, and burnout, or depression, anxiety, and burnout are like they're all buddies. They
Mm-hmm.
all will interplay with each other, because if you have ADHD, your cognitive resourcing and your ability to deplete yourself is through the roof. So you take somebody that has ADHD and you give them a task or 17 tasks to do, they might eventually get those things done, but they bounce around so much within getting those tasks done that they actually deplete their resources so much that, of course, would lead them to getting into a state of burnout easier than somebody that
Mm.
didn't have ADHD. So in those
Right.
patients, treating their ADHD is treating their burnout,
Mm.
right? And it's going to be more effective than just going after the burnout, because you're going after how they look at information and process information. Right.
Yeah.
And so, as you know, in our clinic, we do a lot of neurofeedback, and neurofeedback is really good for ADHD. It's really good for insomnia. It's really good for anxiety. And so, if those pieces are making it difficult for you to handle whatever stressors you cannot control and you cannot change, that's what you have to treat, right?
Mm-hmm.
Because life is going to happen.
Yeah.
Yeah.
Yeah. Speaking of testing, so I recently did a genetic test, and yeah, I kind of found it fascinating just in terms of adrenaline per se. Like I don't break that down very well because I have
Mm,
genetic mutations or methylation and things like that. I guess you look at that
yeah,
kind
that's
of
a great,
side of things
nice
as
one.
well.
That's a great one. Good one. Yeah, so sometimes we do. We don't do genetic testing right off the bat because of
Mhm.
cost, but we
Yeah.
typically will if we feel like we're hitting a roadblock in the treatment, right? So if specifically methylation, COMT, MTHFR, the adrenaline piece is really interesting. You mentioned that one because that's not something that that most practitioners would look at, but
Mhm.
it would be useful because once you have adrenaline, you have to get rid of it. Like you have to actually process it. Otherwise, it you feel anxiety, you feel your heart rating, your heart rate rising, your temperature is up, your ability to sleep is terrible. So the processing the adrenaline, if you had clinical significant burnout and you had an inability or a sluggish metabolism of catecholamines like your epinephrine, norepinephrine, then you are going to be stickier to treat, more difficult to treat, right? But you would need to lean on exercise or movement patterns more, right? Because that is the way that you can get rid of those. You can increase the speed of metabolism of
Right.
those catecholamines is literally physical movement. And exercise is a little bit of a trigger for some people with true burnout because adding anything like a stressor like exercise can make people worse. That's
Mhm.
typically why I bring up just the term movement or physical activity. It could be as simple as jumping up and down and shaking out your arms and screaming into a mirror, right? And you can really decrease the amount of catecholamines flowing through your bloodstream at that during those 2 minutes.
Mhm.
Yeah.
Yeah, probably not like, hit a high intensity training or anything like
No,
that
no.
would be
Yeah. Yeah. If you did do high intensity, it could be very short, intense, like
Right.
short and not like let's say you were in a good place in your life and you knew your resiliency was high and you could handle a 45-minute F45 workout, like a high intensity circuit training workout. You might be able to get away with a 10-minute workout, a 10-minute version of that because
Mhm.
your fitness actually is still there. It's just your adaptation is not. So if you were to go all the way to the point where usually could, you often just don't have the resources available to adapt to that stimulus, which actually makes it less helpful. In fact, it probably is making it harder for you to recover overall. So that would be an
Mhm.
obstacle for you to get over. And that's very common for people that are coming into burnout from an athletic standpoint, or they're just a type A personality that has a high workload at their job. They have a high family load or a relationship load, and they have really big goals from an athletic standpoint. And they're used to pushing themselves athletically, and they don't know how to pull back in that category when the other things go up high.
Mm.
So, from my own personal life, when kids come in, you got young kids in the household, you now don't sleep very well. So if you don't change your program, you're going to run into problems. Whether it's next month, I don't know. Whether it's 6 months, I don't know. But if
Mhm.
you have to have that conversation well ahead of time to make sure that people know that when you lack resiliency in one area because of depletion, right, or because you're not doing any of the foundations that are helping you uh, restore your batteries, I guess would one way of saying it.
Mhm.
um, you have to go down in the stressors that you can control, which is things like exercise.
Yeah.
Yeah.
Would there be, someone was looking to kind of incorporate more of that gentle exercise, whether it be yoga or walking? Is it better to do that in the morning versus like later at night? Obviously not before bed, but
Yeah.
yeah, is there a better time to exercise if someone is experiencing burnout?
Usually, yes. So gentle exercise, you can get away at any time. But if you are going to be doing some sort of a high or moderate intensity exercise, I typically like to do that at your quote unquote physiological peak, which depends on your schedule. But most people, it's not in the morning. So most people, it's not in the morning. You need to let whatever recovery you had overnight and whatever energy or reserves you built up overnight get you through the stuff that you cannot control, right? AKA your job, your family responsibilities, getting the stuff done that needs to get done and you can't avoid it.
Mhm.
And then now you're plugging and playing your harder activity, if you do any of it, at the like usually it's between 3 and 6 or 3 and 7 p.m., which is when most people have a physiological high in terms of exercise response. Now, I don't usually prescribe those types of exercises though. So the low intensity, I'm absolutely fine with you doing at any time during the day. If you like it, right before bed so that you can help you sleep. Some people like a little bit of yoga or a breath work practice, which involves some movement, like a yoga nidra, or a yin, um, uh, yeah, the yin yoga.
Yeah.
Those ones
Mhm.
are very nice for right before bed, in my opinion. Whereas opposed to in the morning, it might make you more sleepy, more sluggish. The opposite is true for a walk. Like I really like doing morning walks in the sunlight. If you can do that. Um, Obviously not with weather like this is kind of crazy, but if
Yeah.
you are in a environment and a time of year where you have light outside, natural light, and a natural environment to go walk in, that is a very restorative activity for most people. And you just
Mhm.
you pick your own pace. And the intention isn't to get a number of steps or isn't get a number of minutes out there. It's just to go out, get the activity, go off a feel, come back when you feel like you've had enough.
Mhm.
Yeah.
Yeah, I think just very individualized, listening to your own body, right? Tuning into that for sure.
Yeah, yeah. It, those exercise like the low intensity restorative exercises almost falls into the bucket of self-care, right?
Yeah.
But self-care, you're not going to self-care your way out of burnout. If you have true burnout, you're
Mm.
not going to self-care your way out of it. You have to probably change your overall life structure. That's the biggest piece. It's a big ask, but at the end of the
Mhm.
day, you end up in burnout because of the way you've structured your life and the responsibilities, whether planned or unplanned, that have fallen onto your lap, right? A
Yeah.
big piece of that I talk about with my patients with burnout is what I call just building the margins in your life. So a classic example is somebody that they have family at home, they wake up, they wake up, they try to get as much sleep as possible, so they wake up a little bit late. They end up rushing through the morning, getting the kids ready, getting out, getting some breakfast in, packing some lunches. They get into the car. They basically build their adrenaline all the way to the office. They end up spiking and crashing all day at work. They having a couple extra cups of coffee in the afternoon just to get through, or they take a cat nap if they can just to get through. They end up coming home. They do the exact same thing again, where they're just running through. But they leave the office at the very last time. They leave the house at the very last time that they can. They wake up at the very last time that they can.
Mm.
They often don't go to bed right away because they feel like they need to veg out at some point in the day after the kids are asleep. And so it's very common to have really no margin within the day at all for something to not go to plan. So
Yeah.
as soon as something doesn't go to plan, the whole day is ruined, right? And you feel that anxiety that that might happen even if it hasn't happened yet. You know, even if you've been doing it really well over and over again for
Mhm.
years and you've been successful at it, you're still running through the day knowing you have no margins. So you have to build in those margins, right? It's like the beginning of COVID when all of our manufacturing capacity crashed because everything in the world was based on just in time shipping, right? And as soon as just in time shipping, one chink in the armor, then the whole thing fell apart because all of a sudden you didn't have the supplies to build cars or build what have you. And so it's the same in your own life as if you don't have some margin for shit to happen, then when shit happens, you are going to feel unable to handle that stressor, which will come out as the symptoms of burnout, right?
Yeah.
You have to throw up your hands and say, what's the point? Why am I doing this? I give up. Exhaustion, fatigue, cynicism, withdrawal, or you get angry, irritable, mad at the world, yell at your kids, whatever it is that, however you show up with those symptoms. But it's very common for that to happen. So you need to think about your life, think about how you structured it, have blocks of time or at least margins between your activities that you have to do where you can you have extra time, like literally extra time that you don't book anything in it ever. And that's
Mhm.
considered margin. It's like having an emergency fund in your
Yeah.
financial bank account, right? It's the same thing for your emotional and physical bank account that you have within your reserves, right? You need to have some emergency reserves in there.
Mhm.
Yeah.
Yeah, and you mentioned kind of that type A personality or maybe the people pleaser or the caretaker, like if someone kind of fits in that category, because it's kind of hard to, if you've been that way for quite a
Yeah.
while, is that kind of something you need to work with a therapist or really focus on, how do you let go more if you're always feeling like you need to be in control, that sort of thing?
Yeah. You just hit like so many of the buttons of
Hmm.
burnout. So
Hmm.
technically, type A personalities are the most at risk for burnout. Technically, neurotic patients are also at risk. Technically, um, people in occupations that involve service, so giving to other people, caretaking,
Hmm.
physicians, those are the occupations with the highest rate of burnout. The highest rate of burnout ever published was in physicians, so in doctors, out of Austria. I think it had like a 50% burnout rate, which is incredibly. Actually, I think that's happening right now. To be frank, I think that's happening right now in Alberta.
Yeah.
I think there's just physician burnout left, right, and center. Not just
Hmm.
physicians, but nurses and nurse practitioners and pharmacists and everyone in the system, because they're getting asked to do a lot, and they have no margins. Like
Yeah.
they have to see 40 people in a day to make enough money to pay off their student loans and, quote unquote, make a doctor's wage. And then they also, their patients aren't really happy because they have to see 40 patients a day, so they're seeing patient every 6 to 10 minutes,
Hmm.
right? So if you are either in that type of a field or occupation, right, where you're giving of yourself to others, you're a parent, especially a parent with young children, and your sleep is affected. You currently have ADHD, right? You currently have a chronic medical condition it's a chronic condition that cannot be reversed. So something like an autoimmune disease, um, those things increase your risk. It doesn't guarantee or seal your fate of having burnout, but it means that you need to build your life in such a way to have a lot of reserve in place to prevent falling into burnout as
Hmm.
much as you can control. Right, your dog dies, you have a divorce, some things that happen. It is fairly common to have burnout occur, um, especially in our type A patients that want to control their world. When they can't control their world, or they're failing to control their world, they're they will end up falling into burnout. But this is the other thing about burnout that I want people to take home from this, is that it's not like you get it and you have it forever. It's just you get it, you recognize it, you have to treat it, and then you can walk your way out of it. It's not something you're going to live with forever. And if
Hmm.
you feel like you are going to live like this forever, I absolutely, you need to talk. You need to get some professional help, whether that's a psychologist, right, or it's a naturopathic doctor. To be honest, it's exactly what we all do. So naturopathic doctors technically all see burnout all the time, and
Hmm.
whether they specialize in hormones, or they're in gastrointestinal health, or they're in pain management, or they're in cancer care. Oh my goodness, like autoimmune patients, like we see this all the time.
Hmm.
And so we will recognize and understand how to support you, how to build you up. What do you need? What kind of a reasonable, manageable, relatively low ask treatment protocol can we do for you, right? Because
Hmm.
at the end of the day, you can't go to somebody that gives you 12 pieces to do. You go to the very first visit, you get an essay to complete as your homework, and you have 10 or 15 different things that you have to do to correct your lifestyle. It's like, and those people aren't respecting the fact that burnout is literally due to too much on your plate right now.
Hmm.
Yeah.
Yeah, I think it's just keeps getting more and more challenging just with the way our world is going, right? Like 50 years ago, it was maybe people experienced it, but not to this scale, I don't think.
I think it's yeah, there's a handful of things in that. I think it was happening a lot before, but it was
Mm,
happening in different ways.
right.
Now it's really in your face because everyone is wearing all of the hats. Let's
Hmm.
pretend like we're living in a world where everybody has ADHD. Not literally, everyone has ADHD, but everyone has to wear all the hats all the time, and they're flip-flopping between them. And you're never completely done your parenting responsibilities, right? You're never
Mhm.
completely done like curating your social media. You're never completely done, especially if you're a business owner or you're in the medical field and you now have to not just work on seeing your patients or doing the best work you can with the person sitting in front of you. You have to think about the marketing. You have to think about the keeping the lights on, the overhead, and keep making sure
Mhm.
that you have payroll done and all this other stuff. And in a microcosm, we all are doing this where we're taking on a lot of stuff, a lot of have tos, or we should do these, or we should do this, we should do this. And we're taking all of those things on and we believe it. Right. And
Mhm.
I think that that's maybe back in the day, people just didn't believe you had to do that. You just had to,
Yeah.
go to church and, respect your family, go to work, and then, you punch the clock. And once you're off the clock, you're off the clock. And now it's like you're not ever off the clock, man. You got email, you got a way that I can reach you at all times. You have Slack on your
Mhm.
phone. It's not great. And then the scrolling aspect too, because a lot of this is expectations. And I mentioned at the very beginning with burnout, a hallmark of it is feeling like your sense of accomplishment is poor. You feel like you're not doing a very good job. And so
Mhm.
if you're comparing yourself to whoever you're seeing on social media or on news constantly, of course you're not going to feel like you're doing a good job. No one feels like they're doing a good job when they compare it to an ideal, right?
Yeah.
Or a scripted form of life, right? We all understand this rationally, but it affects our emotional and our limbic brains. Like our monkey brains still fall prey to all that stuff.
Yeah.
So sometimes it is like you have to get off the social media, or you have to scroll less in some way. And for a lot of people, especially type A, it's not just social media. It's like stocks. How often are you checking the markets? How often are you checking your financial stuff? How often are you double checking X, Y, or Z in your budget, like living in the
Yeah.
spreadsheet? How often are you checking news, especially bad news? Technically, the consumption of bad news increases your risk of burnout.
Mhm.
Consumption of good, positive news has no effect. So it's not like you get a little bit of good news, a little bit of bad news, and you're even. It's like you get a little bit of good news, you haven't moved, and you get a little bit of bad news, and you're actually worse.
Yeah.
Right? So your consumption of news matters a lot too.
Mhm. What about like the social connection? Just talking about electronics and the internet, like we're all so connected via the
Yeah.
internet, but we've really lost that face-to-face connection a lot. Is that important in terms of, helping with recovery from burnout? Just those
Yeah.
meaningful connections, people that kind of fill up your cup instead of maybe necessarily draining you or negative.
Yeah. Honestly, can't really say it better than that. That's exactly what's happening. So if you have purpose in your life, you have social and personal relationships that are also meaningful, those are going to be protective against burnout. And so if
Mhm.
you have those things and yet you don't invest in those things, you don't get the benefit from them, really. You
Mhm.
might, but it'd be less than what you should. So from a social perspective, you need to engage in those social networks that can basically provide resilience to you in times of need. So if you're going to go through a tough time, you need to know there's somebody to call, right? And
Mhm.
if you don't invest in those social networks while times are good, you're not really sure if those people are there and when you actually need them, right?
Right.
And I do think that time, like everyone, this is why burnout is so funny, because everyone has heard the term. They've probably used the term. We've waxed and waned with different variations of it and different severities of it. But everyone also knows the aspect of filling your cup with activities that literally light you up and fill you up, and you feel more energized doing them.
Mhm.
We don't choose to do those enough because it's selfish, or we quote unquote don't have the time to do it. They fall by the wayside, right?
Mhm.
Or we're swapping it out for cheaper versions that don't feel like they fill you up, which would be those digital versions of connection, to be honest. Yeah.
Mhm.
So if doing X, Y, or Z with your friends fills you up, you technically need to do more of that. That would be more beneficial to you than going to get a massage, right? Or
Right.
get
Yeah.
a bath with essential oils, or like, what have you, in the terms of self-care. Because if
Yeah.
your focus is on yourself constantly, that's just it makes it very difficult for you to get out of that rut, right?
Yeah. Yeah, I think that's what I kind of took away. I don't know if you watched some of like the Blue Zone. I can't remember exactly what it was called, the Netflix series. I know there's several books, but so
Yeah.
many people were focused on the food aspect, right? They went crazy with, oh, I need to eat like a purple sweet potato and I'm going to live till
Yeah.
100, but maybe not focusing on, well, no, all those people have amazing social connections and, they're not sitting at a desk. I know that's maybe difficult for some because that's our job, but yeah, looking at those lifestyle components more than just diet seem to be more beneficial than just focusing on diet per se.
100%. Yeah. Yeah. This is a great use case to bring up that because um, adding stuff in and like, I have to do this to my diet. I have to add this thing in. I have to add this supplement in. I have to do this more of this type of exercise. I have to X, Y, or Z. It's all these add-ons. Those
Yeah.
add-ons actually take away from your ability to recover from burnout. It slows your recovery. Um, because they're not big levers. The big lever is exactly what you just said. The relationships that you have will predict a long and healthy life, right? I can't remember the name of this study, but it's the longest um, prospective cohort study in the world. It's running over 100 years out of Harvard, where they were assessing essentially a group of well-off well-off people in Boston and then people across the river where they weren't as well off socioeconomically, and they followed them, they followed their kids, and they followed their grandkids, and then they basically have been collecting data all along. So it's still running. They're still collecting data every
Mm.
3 to 5 years on these patients, and their takeaway in terms of what predicts longevity, so just in how long you live,
Hmm.
was the quality of your relationships. So outperformed their cholesterol levels, their blood pressure, whether they smoked, whether they had, X, Y, or Z medical condition, or they ate a specific diet, or X, Y, or
Hmm.
Z physical activity, sedentary versus active. The fact is that you have good quality relationships. You have probably reason and meaning. You have reason to take care of yourself, and you have meaning to look forward to, and have hope, and have things to work towards that fill you up. Because you could
Hmm.
do things that are very stressful, but you feel like your cup is filling from them because they're very meaningful, they're very purposeful. And as long as you also have some margins around those things, you will get a positive adaptation to that, right? You're not
Hmm.
going to get beaten down from that type of a stress.
Yeah. In terms of supplements, like I always thought, less is more. And maybe, if you are kind of in that chronically stressed place, it's my understanding like you use up more of your B vitamins, vitamin C, etc. In that situation, would taking a few things just kind of help replenish
Yeah.
those stores? Yeah.
Yeah, you mentioned the big ones. Honestly, from a supplement standpoint, because there's been actually a decent amount of studies on this in subsets of burnout. Um, Vitamin C, classic one, right? That helps deal with, it basically helps down regulate the sympathetic drive, right? So that's an important part. Magnesium is the same. So magnesium bisglycinate specifically, typically dosed at night, also helpful for down regulating the sympathetic drive, right? The adaptogens, so if you've heard of the compounds adaptogens, there's a whole host of them, from functional
Hmm.
mushrooms to ginseng to ashwagandha to rhodiola. Actually, quite a few of them have been studied in burnout because they are thought to have their greatest effect on the HPA axis. So typically from a supplement perspective, you would do something for the HPA, you do something for the sympathetic side, depending on how that person is presenting. If they're very deep into the burnout, you need to do more sympathetic driven treatments at first. The HPA axis, you can start treating those. You can start to do some nutrient IV therapies or some adaptogens, but it's going to take a long time before they notice any effects from those things.
Hmm.
Yeah, but ashwagandha has research on it. Rhodiola has research on it. Ginseng has research on it. Some of the functional mushrooms have some research on it as well. So depends
Hmm.
on what else the patient is dealing with, is which one I would pick and the dose that I would start with. Yeah,
Right.
yeah, yeah.
In
But
terms
those are
of,
good.
yeah, in terms of like psilocybin or CBD, are those something, especially if maybe there's some childhood trauma or things like that to kind of help? reset the brain that way.
Yeah, I mean, this would come down. That's a bigger conversation, I think. The way that I would approach that is we would do a brain map at our clinic, right? Assess the way your brain is functioning, how it's working, what are
Right.
your typical ways of getting stuff done, and your likely. I don't want to say faults. Faults is the wrong word, but the
Mhm.
areas where you are most likely to get you in trouble, and to address those things. And yeah, sometimes it's very clear that there's some sort of an emotional or developmental trauma piece, and that would be you work with a psychologist, work with different types of management. Obviously, psilocybin is illegal here in Canada. Not a ton of research on it right now, and in obviously none in burnout, but those are being done in depression, treatment-resistant depression,
Mhm.
different forms of PTSD, I believe, as well as um, potentially some sorts of terms of anxiety, forms of anxiety as well. But I think we're, you know, 5+ years off before we can really have any idea on how we would use that in clinical settings, right? Outside
Right.
of just us with the psychologist on board. Yeah,
Yeah.
yeah. You end up the way that I think about this is keep it simple, right? You probably know better than I do when you walk into my office what you need to change. But sometimes when I ask those questions and it comes up and you're verbalizing it hits home. And I
Mhm.
maybe verbalize it back to you and it hits home and you go, yeah, that's it. That's the thing I need to address right now. I need to have that conversation. I need to make sure that I get some more help in this specific thing at home. I need to have that conversation with my boss or whatever you're doing, right? And that know thyself component in burnout is more important in burnout than it is in so many other conditions, because the types of stressors that don't really drag you down, and the types of stressors that do, and which ones you're avoiding, the things you're really dreading to do, the things you're putting off. This is why ADHD is related to it, because ADHD, you put off a lot of stuff and you come
Yeah.
back and forth on things that you don't really want to do, um, and so that never goes away. So it's always in the back of your mind. So the individualization of treatment is the reason why naturopathic doctors are, you know, the bee's knees in this case, because that's all we do. That's all we
Yeah.
do, right? Is individualize our treatment, have a discussion, be honest, start at the foundations, build your foundations, be very simple with our treatment protocol, such that we probably remove a lot of stuff before we add anything in. When we add things in, it's going to be really easy things to start, really easy things to focus on continuing,
Mhm.
and you need to continue it for a long enough period of time to actually get the benefit, because it's not going to be like that. It's not going to just turn the
Mhm.
corner in a night, right?
Yeah.
Yeah.
Yeah, I think too, just educating people because they might not know. Like, I remember a couple years ago reading that our nervous system is regulated by our relationship. So if we're in maybe an unhealthy relationship, we might not even realize how it's actually affecting our nervous system.
Oh yeah.
Um, yeah,
I
so like
think you
hearing
do.
things
I
like
think
that.
people do know that.
Well,
I think people, like, they know they're walking on eggshells, or they're not they don't say what they want to say.
yeah,
And
yes,
that's a mirror, right? Why
yeah,
why isn't it that I don't want to say this to, somebody I quote unquote love, or they love me? Like, what are you fearful of? So yeah, absolutely, the relationship piece is it can be a big part of your resiliency,
hmm,
or the opposite. It
yeah,
can be a stressor. And that's sad, right? That's sad to the point where you can't ignore it, right? Because that's only going to make it worse, and they're not going to be able to read your mind and figure out what to do to fix it.
hmm, yeah,
So you need some outside help. You need a third party to look into that and help you with that. But yeah, it comes down to, again, that knowing yourself and knowing the people around you that you can lean on, and the ones that you might want to uh, have a discussion about, with somebody about that.
yeah.
Manipulating their relationship in some way, right?
Hmm.
Yeah.
I think too, like somatic therapy now instead of just, I mean, the talk therapy is great too, but we always think it's just our brain, but we hold a lot of trauma or stress in our bodies, and it can kind of give us signals. So kind of working through that, I find, is a
Yeah.
whole other realm as well.
Yeah, 100%. 100%. Yeah.
Mm.
Yeah. Yeah. I agree. You probably have to have a psychologist on that does that specifically. That would be
Mhm.
an awesome conversation to have, as somebody that specializes in that. That'd be
Mhm.
great. Yeah.
Yeah.
Yeah. I feel like just to finish up the burnout talk, because a lot of
Mm.
people will feel, coming out of December can be a really crazy time. A lot of over committing to things, and then now you're noticing how drained you are,
Yeah.
right? So some really easy basic things that you can do is go back to the basics in terms of preventing that from happening again. So saying no to things you don't actually want to do, prioritizing but not obsessing about self-care. So prioritizing self-care to me just means like you prioritize your sleep window. You make sure that you have a decent amount of time given yourself to sleep. If you're struggling to sleep, go get support with that. Okay. Don't just wait for that to show up with metabolic syndrome or dysregulation of your glucose or burnout. You have to
Mhm.
figure out the sleep pretty early. Move, but be mindful of the adaptation you're trying to get with movement or exercise. So regular, reliable exercise is a resiliency factor. So if you are highly active, you technically have lower risk of burnout, with the exception of elite athletes. They have higher risk of burnout. And they're obviously they're walking the line, they're walking the
Mm.
tightrope. But it comes down to resiliency. So if your body is very capable, across the board, then you're going to be more capable of dealing with various types of stress, right? And it also processes the sympathetic drive related stress, right? So
Mhm.
the movement, exercise, sleep foundation, relationships, you already mentioned that. Um, and say no to things, finding purpose, finding meaningful things to work towards that fill your cup, like you already mentioned before. And then
Mhm.
if you do have an inclination to do a mindfulness based practice, I think that can be another really nice thing. Um, Usually, when I'm building a stress or resiliency protocol for patients, it's going to involve some form of exercise. Sleep is foundation, and there's some form of exercise. There's usually some sort of a hot cold related therapy, because it's really
Mm.
easy to do, really easy to manipulate, and you get a great response from it,
Mhm.
right? And then there's mindfulness. And mindfulness it can take a lot of different forms. It's not always meditation, but that's the one people understand. And it just comes down to you understanding how your brain is working,
Mhm.
and you building the resiliency from the ground up, and then you become more and more robust.
Mhm. Yeah, awesome. Okay, maybe let's get to some questions here. So I have ADHD and chronic fatigue. Um, yeah, experiencing fatigue in a huge way. So yes, there will be a replay of the session as well. Yeah, if you would like to work with Dr. Nelson, I'll send that info, just the general email and contact as well.
Yeah.
Um, so how long approximately does it take to recover from burnout? I recently retired from a nonstop job. Taking adaptogens. I'll increase in vitamin C and magnesium. What can I expect?
Yeah, that's impossible for me to give you an answer on that. I think that depends on how deep you are into the burnout. If you are fully retired, that does set yourself up for success in some ways, but it can withdraw. If it's withdrawing you from all of your known social circles, that can be a risk factor. So you kind of got to look at your life and the way it's structured right now. It can be, it can actually be quite rapid. To be honest, I had patients that have jumped out or burned out quicker than expected, but they are the people that have a strong social support. They usually have decent sleep. They usually have decent nutrition. So they have the foundations already ready. They don't have a medical condition like chronic pain or an autoimmune disease that's depleting them constantly. And they're the people that, if they just direct their resources in a direction that they know will build them up, and they're sustained and consistent with that, it doesn't take very long. So I don't want people to think that they're stuck in this state and they're going to be exhausted, and every time they exercise they feel worse, and they're snappy and short and irritable with people, so they don't hang out with people. That's the vicious cycle you want to avoid, is the withdrawing from things because you are so tired and so fatigued. In this case, you're setting yourself huge margins by retiring from that main stressor you had, then it shouldn't take that long, to be honest, unless there's something else holding you back. And that's where you need to have a conversation with somebody one on one.
Hmm.
Yeah.
Yeah.
Any other
Any more
questions?
questions? I think we covered a lot in an
That's
hour.
good.
Yeah, I guess takeaway is, like you said, trying to get ahead of it if you're not in that kind of complete burnout, and getting some testing done, right? To just really narrow down like a treatment plan instead of figuring it out on your own.
Yeah. One aspect of burnout that we didn't talk about at all, but I'll plug um, my wife in this actually, because she's a naturopathic doctor who specializes in perinatal health. And it's so common for mothers, especially in
Mm.
the postnatal depletion phase. So after they've given birth, they have no sleep. They've had their resources sucked from them for the entire pregnancy and then even breastfeeding.
Yeah.
They your rate of burnout is incredibly high during that time, and it will go hand in hand with postpartum depression. So it's not guaranteed. If you have burnout, doesn't mean you're going to get postpartum depression, but if you have postpartum depression, guaranteed you have burnout. So it's an interesting thought. But that these are people, so it brings up this aspect of burnout that we haven't talked about a lot, which is the depletion aspect, which can be like physical nutrient based, right?
Mm.
So some of those people can respond really well to, like, if they are low in iron, from an iron infusion, an iron IV, right? Or if they're low in B vitamins, B vitamin supplementation is fairly well absorbed. You should respond relatively quickly. If not, you can get IVs for that. So or if you have any type of malabsorption that goes along with it, because burnout will often affect the digestive tract, which I didn't talk about in enough detail. But
Right.
the digestive tract, obviously, malabsorption syndromes will lead to nutrient depletion, which will make it harder for you to recover. So it comes down to like identifying all of those things and then addressing them before, not ignoring those things. You need to address them as you're trying to recover. Yeah.
Right. Yeah, we just had one last question come in. So what kind of mindfulness practices do you suggest?
Yeah, I really like transcendental meditation as mine, or some Vedic meditation is another way of saying that. But and then exercises are my two. So the way that I view mindfulness is, you can be meditative in a lot of different way, and you can be mindful in a lot of different ways. But the classic structured approach to transcendental meditation is really appealing to me. So look into that one. It's more That one is mantra based meditation. So instead of mindfulness, where I'm always looking at all of my thoughts and letting go, and I'm being aware and I'm letting go and I'm being aware and I'm letting go, and I'm just being mindful of what's happening. It's
Mhm.
actually where you're placing your conscious awareness on something specific, like a mantra or a candle, and then you basically let the subconscious process all that stuff. And it actually also helps mindfulness, even though you're not cognitively forcing it. So if people
Right.
are in burnout, I really like the mantra based ones because it's easier for you to do. You feel like you're actually more energized after it as opposed to depleted, which is really important in this circumstance.
Mhm.
And then exercise, I think, is a piece. But I will actually put a little note also on journaling. So journaling can be a
Mhm.
mindfulness practice where you are getting something out onto the page. And some people really like that first thing in the morning when they're fresh, they don't have distractions. Other people like that actually right before bed, so they can get stuff out, and that they're not ruminating and thinking about it all night, affecting their sleep. So those are
Mhm.
my they're not true. That's not like a true mindfulness practice, but it's being aware of how your mind operates. And so in my mind, it's similar.
Mhm. Awesome. Okay, so I think we'll wrap it up there. Thank you, Dr. Nelson. That was awesome. Very formative. And thank you everyone for joining. And as I mentioned, I'll be sending out this sometime tomorrow.